Hello, my name's Huw Stone. I'm a consultant forensic psychiatrist and I work in the Surrey Community Forensic Service. I'm going to talk to you today about forensic psychiatry, and I'll begin with a description of forensic services and also how they developed. I'll then go on to talk about the criminal justice process and focus on a number of key legal issues that arise. Lastly, I'll talk a little bit about risk management, particularly focusing on violence and mental illness. So what are the purposes of forensic mental health services? In many ways they're very similar to the general adult psychiatry services, with the added dimension that our patients have usually posed a risk to other people, and that risk is usually related to their mental disorder. We provide treatment in a number of different settings, including in the community and hospital, and particularly in secure hospital, but also in prisons. The treatments we provide are very similar to those provided by general adult services. Forensic mental health services work with the other mental health services, usually to provide specialist risk assessment and management advice for patients who might be at risk to others in the community. We also work with the criminal justice system agencies, and this is usually done via multi-agency public protection arrangements, often referred to as MAPA. We also provide other services within the criminal justice system, including liaison and diversion and prison mental health in-reach services. In addition to all these, we provide specialist training and education and support research and audit within these services. This diagram describes the pathways through the criminal justice and mental health services. It shows that the forensic services based around secure hospitals act as a buffer in between the general mental health services and the criminal justice service agencies. They also show the links between community forensic services. The forensic mental health services are structured around secure inpatient services, and these operate at three levels: high, medium and low secure. The high secure services are based at Ashworth in Liverpool, Broadmoor Hospital in Berkshire and Rampton in Nottinghamshire. Medium secure services are based all around the country, and there are also low secure services which often include PICU or psychiatric intensive care wards. There are also an increasing number of community forensic teams. The development of these services did not necessarily come about as a result of government strategy or initiatives. But in my view, they followed the case of this man called Graham Young, who was a poisoner. He poisoned a number of his family, one of whom died, in the early 1960s. As a result, he was sent to Broadmoor Hospital for treatment. He remained there for a number of years and was then felt to be safe enough to be discharged in the early 1970s. He then went to work in a factory which made photographical chemicals, and very soon a number of his co-workers started becoming unwell. Nobody knew about his background. After one of these people died, the police were involved because it was clear that they had been poisoned. Eventually they looked into Graham Young's background and found out that he had poisoned other people in the past, and he was convicted of the murder of one of his co-workers. On this occasion he was not sent to hospital, but was given a life sentence and sent to prison. It's interesting to note that in the early 1990s, one day he was found dead in his cell, and it is felt by some people that he may have poisoned himself. Following his case, the government set up 2 independent inquiries to look at what had happened. And those inquiries recommended the setting up of what were called regional secure units. It was intended that these services would provide a bridge between the special hospitals, as they were then called, such as Broadmoor, and patients being discharged to the community. And they acted as the forerunner to current forensic services.